Hello everyone, welcome to my channel. Today we'll be talking about some of the clinical anatomy of the cervical vertebrae. So let's talk about the first one. First one is the prolapse of intervertebral disc, which is taking place at the junction of C6 and C7 vertebrae, and compression of nerve is taking place, which is leading to the numbness or pain in the upper limb. So this pain is not localized, moreover it's a radiating pain. If we see in the image, we can clearly see the compression of the nerve taking place between the two cervical vertebrae, and in the second image we can clearly see that the prolapsed disc is compressing the exiting spinal nerve root at this level. So I need to tell this very important point that disc prolapse, disc hernia and disc bulge, these are different spinal issues. So basically some people are mistaking it, calling it as the same. Let's move on to the second one, which is osteophytosis. It means that the bone is becoming weak and it is getting in the form of fragments which are called as bone spurs. So it is touching some of the artery or ligament and vertebrobasilar insufficiency is taking place, which means temporary reduction or blockage of blood flow to the back of the brain, which means to the posterior aspect of the brain. If we go to look for the image, so in the first one we can clearly see the normal cervical vertebrae, and slowly we can see the formation of small bony outgrowths which are also called as osteophytes or bone spurs, and slowly the bone margins are becoming irregular. If we see in the last image, the vertebral structure is appearing much more degenerated. We can see in this image. So the patient is suffering with dizziness in this case. Let's moving on to the third one, which is atlanto-occipital assimilation. When the atlas, which is the C1 vertebrae, it is mimicking like the occipital bone by fusing with it, this clinical anatomy is taking place. So the patient in this condition is suffering with neck pain, posterior headache means headache at the back of the neck, dizziness, fainting and vertigo. So I would like to talk about the vertigo. It is a false sensation of motion or spinning of the head. So if the patient is lying, they can feel that they are moving or the room is rotating around them. So that's it for today. Thank you. I'll be talking about much more clinical anatomy of the cervical vertebrae in my next video. Please subscribe my channel.